don't narrow yourself down to one product or, one program or anything like that. It takes a combination of different things, environmental. It takes a combination of different products you're going to use. I think it's a whole program approach, which I know we preach and talk about quite a little bit, but we all get narrowed down into it, whether it's because the message we're receiving from different groups, it's one topic at a time or one product at a time, or whether it's economic that we can't afford to put 5 different products in the feed or the water line or whatever. It just becomes too expensive to do. I think there's probably some companies that are a little bit better leveraged for that than others because they have more products they're dealing with. But I think it's a bigger program approach versus we're just going to throw one product in there and save the day. I just don't think that exists.
Hi, everyone. Welcome to the Poultry Podcast Show. I'm your host for today's episode, Dr. Karen Grogan. And with me today, I have Dr. Dan Moore with Colorado Quality Research. I knew that I was going to bumble that one because if you say it really quickly, that's a lot of the same sounds. So Dan, why don't you tell us a little bit, first maybe your background, how you got to where you are, and then what you do at Colorado Quality Research. There, I had to slow myself down to make sure I said it right.
We just call it CQR to make it a little bit easier.
Well, I was going to do that because I have been familiar with CQR for a really long time, but then I was like, no, I need to say their full name and say it correctly. So good. CQR. We'll do that from now on, like in a scientific paper. We'll use the acronym from now on.
Perfect. Yeah. So my background a little bit is I started out at the University of Missouri. Got a bachelor's in animal science. I'm from Northern Missouri originally. But going through that process, like everybody else, my father's a veterinarian, my brother's a veterinarian. So I was thinking, well, maybe I'll go to vet school.
Didn't end up in the family business.
I did not. And my uncle's actually a veterinarian as well.
Oh my gosh.
Yeah. So once I started going to school, I was like, well, there's not much room for me to be a veterinarian anymore. The family's kind of taken over all of that. So I started looking at different areas, and after my bachelor's, I got a master's in poultry nutrition there at the University of Missouri. And then I thought, well, maybe I better spread out a little bit, learn some new things. So I went to North Carolina State.
Yes,
and
go Wolfpack.
There you go, yeah, and got my PhD in nutrition with a minor in biotechnology. And then, as you're going through that journey, I ended up doing a postdoc with the USDA out in Fort Collins, so only about 15 miles south of where I'm at now. So I was there for a couple of years, and it was more it was at the National Animal Germplasm Program. So it was more reproductive physiology, looking at primordial germ cells, a little bit different than what I was doing for my PhD work, but something interesting. And I always liked poultry in general. So I thought, well, maybe it'll expand my knowledge a little bit, learn some different things, different lab, that kind of thing. And so after that, I actually ended up going to a feed additive company and was there for 4 years, looking a lot at intestinal health type of, products and that sort of thing. And as I was there, I became a client at CQR. And so I had got my first experience with CQR about 2007 and, enjoyed what I was doing out here with them at the time. And then I went with actually a seed company that was working on a nutritionally enhanced corn product and was the nutritionist there, helped them go through the business models. It was a very interesting experience for me. Got to see a lot of different things, work with agronomists, but then also, work with nutritionists in the field and that sort of thing. And I continued doing work with CQR at that time. And during that process, I was having conversations with the previous owner at CQR. He was looking to get out, and I was always interested in this. It's actually something I had been interested in doing. I didn't really know what it was, since I was in high school. It's like, well, I'd really like to get in the poultry side and do that. And it all kind of fell into place. And so I came out here in 2014. This is one of the owners with my business partners, president of the company now. And so I've been here about 9.5 years so far.
Excellent. It's interesting the sort of curves that your path takes. That's you decided to take the path with, I joke around that nutritionists make more than veterinarians, so you definitely pick the better path now. We have a couple of like veterinary students that then go on to do a PhD in nutrition. I was like,
There you go.
you really want to like, do this, veterinarian nutritionist, kind of are like in your head all the time, right?
Yeah, exactly.
Yeah. So,
My business partner is a veterinarian, so I'm around veterinarians all the time. So it's pretty easy for me to see both sides of it.
right. And it's part of your family. So you've
Yeah,
grown up
exactly.
dealing with it. Well, so why don't you tell our audience sort of what CQR does in terms of contract research, and then what are the key types of either products that you do work with or diseases. So fill us in on that.
Yeah, so we're a private contract research organization, obviously, and we work closely with several different universities at times. We try to partner with them when we can. But people do a little bit of different research with us, something that's a little bit maybe more marketing based or competitor comparison, they may not want published. So we leave that up to the client, if they want it published or not. So it's not necessarily something we strive to do. It's just a matter of what the client wants to do. So if there's something they were trying to figure out before they went out to the marketplace, we'll do that kind of work. So we really divide into a couple different types of categories of work that we do. One's the nutritional side, obviously. So, where there's enzymes, minerals, anything like that, or any of the probiotics, prebiotics, there's a long list of classification
Right.
of products in that area we obviously do work with. So we'll just do basic, sometimes performance studies with that. Just seeing, does the product do anything with feed efficiencies, obviously growth and that side of things. So that's a pretty simple side. We do that. We also do what we call GLP work, obviously something that's going to be presented to governmental agencies for deregulation of a product or approval of a product, something like that. So we look at different corn varieties at times. We also do target animal safety studies if we're looking at some kind of drug or pharmaceutical to see if it has any, what impact it has on the bird. And we take several different tissues for that. That's where my get a little bit of veterinary side comes in to play that part. We have several disease challenge models here, primarily work with Clostridium for necrotic enteritis. We've got a couple models doing that. We do coccidiosis work here. We do salmonella work. I've got 3 salmonella studies going on right now. That seems to be it kind of ebbs and flows.
Right.
But people's
It's a hot
interests are
topic again.
yeah,
Yeah,
it
it's a
kind of
hot
comes
topic.
and goes, all of them. And so you're trying to stay up as much as you can on them. We're doing that. We've got some E. coli. We do some E. coli challenges as well. So just a variety of those type of things. And then we'll do some basic some pharmaceutical type stuff on birds. And we're probably doing 90% broiler work, and then the rest is turkey and a little bit of layers. We can do some breeder work as well, but most of the demand is obviously on the broiler side. We'll probably run 3 or 4 turkey studies a year, and maybe 1 or 2 that pertain to the layer side. But most of what we do is the broiler, and we have a small nursery pig facility as well. So we've got our main facility, and then me and my business partners, we own a preclinical research company as well. That's about 10-15 minutes from here. This is more of the lab animal type stuff. And we have some of those facilities we lease through CQR to do some more specialized work on the poultry side. And that's where the nursery pig barn is as well.
Great. So it sounds like you can do a wide variety of research. And in terms of, you hit on a lot of sort of current topics that are trending in the broiler industry. So we always deal with clostridial challenges, which I know you guys have a really good predictable model for that to try different products in our move away from antibiotics. That's why we're testing a lot of these products. What are sort of your biggest takeaway messages from, like, if you had to look at sort of the breadth of the research that you do in that?
So there's a couple different ways I think you could approach that, right? I mean, one is what causes a disease. So when we're trying to do research models or something like that, you're trying to do something that's predictable. obviously, which can be difficult when you're dealing with diseases and stuff,
Right.
and
They're
just
hard to
birds in
reproduce
general.
sometimes.
Yeah,
It
exactly.
doesn't
And,
work when you want it to work.
and as I always say is, if every bird reacts the same, they're either all going to die or they're all not going to die. So, trying to hit some of the targets can be difficult at times, but, we work with everybody to do that. So, I mean, I think you can look at it from a research perspective, how do you see the disease in a research environment, as well as, how does that relate to the industry? So as you well know, from a research perspective, you're trying to balance those two things, something that's repeatable, something that you can predict, and something you can create, but at the same time, does that mean anything to the industry perspective? Then the other side is, what do you see out of that research? What kind of products do you see that work on that
Right.
side?
That's what
And
everybody wants to know. What actually really works?
everybody, I think, knows the same thing. There's some products that work. There's some products that work a little bit. It might be a combination of products. It might just be situational at times, as to what works. And I try not to be a commercial for anybody or market for anybody. So I try to just, here's what we find and here's what we see, and so especially with the Clostridium or any of those, disease challenge models, you're trying to create the correct environment for it to exist, right? I mean, so we work very closely with a microbial company that houses all of our bacterial pathogens for us. We do the coccidiosis in-house. So they'll grow it for us. And, so the takeaway a lot for me, especially with, Clostridium, necrotic enteritis, there's a lot of environmental factors that come into play, even that, as everyone knows. But, out here being in Colorado, it can be fairly dry.
Right.
And so, for us to create something like that, one big factor is humidity. And we try to create humidity in the barn a couple different ways, by adding water into the system. But we also watch, we have, with our daily checks every day, obviously we're taking temperatures and humidities and we're watching that. So you can do a couple different things. You can, have the number of birds in a pen, for example. The more birds we put in a pen, the more humid the litter becomes, the more wet the litter becomes, even when they're younger. So that is a factor at times, so how crowded are they versus, how the density essentially in the pen. Some other stuff we've seen before. When I first started here, everybody wants to use litter, a reused litter. You're trying to, recreate the industry to some level. So we started doing that, and I was getting flat a lot of times. I wasn't getting the challenge I wanted, So we started doing some work with clean litter versus reused litter. And we were finding, with the clean litter, it was easier for us to get the challenge than the reused litter. And, I didn't really test it that deep or go into, do a lot of counts on the litter or anything like that. But, our kind of hypothesis internally was just, is there something in the litter that's giving some immunity as we place the birds? Mm-hmm. And we just found it was more predictable for us to use clean litter or clean shavings, in the beginning. And that allowed us to kind of set the whole system up the way we wanted to, whether it's the coccidiosis vaccine,
right,
a cocci challenge down the road, and then coming back in with that Clostridium challenge. And so that was helpful. But the flip side of that is you're trying to create humidity on top of that, right, which usually the pine shavings a little drier. So we're doing some things, to get the humidity up in the barns, using clean shavings so we can predict it a little bit better and try to get that a little more standardized as much as possible. Then we obviously looking at feed changes. We like to challenge when we're doing a feed change, either it's feed form or feed type. A lot of people will use wheat in their model. We do that some, but we don't necessarily have to have that. So we're always trying to look at strains. We've got a couple different strains of Clostridium we work with. And even since I've been here, we've got a traditional strain. We've got a new one now that we're utilizing, but we've gone through several strains and just see with our model, does it work? And most of them don't, and so it's just trying to create that environment where, I think with humidity, with feed changes, with different feed stuffs, trying to get that created along with your coccidiosis vaccine, as well as potential, if you're doing a 10X, a lot of people use like a 10X cocci vaccine at 7 or 10 days of age, or even a couple of challenges before. And so that's where that comes in, right? Because we're trying to do something with the industry. So, we remove them from feed too for a few hours. During that feed change, you'll try to get a little insult to the gut and put the feed change back in. But we're trying to do that as minimally as possible. because we've done 3-day challenges, we've done gavage, we've done on the feed, we've tried a bunch of different things, but we try to get as close as we can to the industry side of things. And that's kind of I think that's where challenges come in when you're trying to create these models is trying to balance all of that.
So then in terms of, you hit on a lot of great things there, in terms of how we create these sort of end diseases is, you have to pile on several things to get to this endpoint. So feed changes, we know that's a key. Those transitions, as you said, in ingredients, in how it's presented to the bird. Feed outages are huge. Like you were saying, we take them off a feed, we create that stress. A coccidiosis challenge, which sometimes is we gave it to them. We use vaccines, we give them coccidiosis in an attempt to give them immunity. So I think that everyone can appreciate necrotic enteritis is probably one of the most complicated, things to reproduce. So, I think that you can take away from that, like when you do have it in your operation, like it takes a while to then figure out,
Definitely,
like to work backwards and be like, okay, what of these things is not work, and it's so many things. So I think everyone who's dealt with it and continues to deal with it has to keep all of that in mind.
Yeah, without a doubt. I mean, it's multifaceted for sure.
Right. So if you, from all of that, from everything that you know, what would be the most perfect way to prevent necrotic enteritis from happening? No cost involved. Expenses barred, right? No cost involved. So from your nutrition hat and your necrotic enteritis challenge hat. So
the perfect way I think would probably raise them out here in an environment like this, where it's really, really dry. Control the density a little bit. These things are not necessarily practical.
Right.
I'm just coming from experience when the challenge doesn't work for me. What have I seen whenever I do a study and it doesn't work? I think it's extremely dry. Where you're not having the cycling of the cocci isn't quite as great. I think you keep that under wrap a little bit. So I think definitely coccidiosis control. However you can manage that. Like you said, we're giving vaccines, so we're giving it to them at some level. But I think environmentally, that's one way to do it. And I think there's more aspects to it than just overall humidity, right? Like we was mentioning the bird numbers in the pen. We get litter moisture. I think I've not really tested that or studied that, but I think if you're looking at it, that's a good place to start. Really, whatever can you do to kind of stop the cycling of cocci at some level, which would be the dry atmosphere. I always say I could raise antibiotic-free birds out here, no problem, if I just had enough water to get. That's right. Our big issue out west is watering the animals themselves. So, I think you can do something in that regard. But most of our birds are raised in the Southeast, so that's not necessarily practical. So, I think at that point, you're not really containing it all the time. I think some of our practices that we're working with litter, I think, help. Whenever we're trying to maintain litter quality, I think that's helpful. Whatever we can do with the coccidiosis cycling, I think that's helpful. And then just a lot of it's management practices too. Like you were talking about feed outages, how do you protect it? If you can continue to have the feed with them, a little bit more standard with your ingredients. But once again, these things, but that does cost money, so you're talking zero cost. Some products we've seen that have done really well, just in a general sense, like copper, for example, is done extremely well, or at least in our model. And so a lot of times, NRC, you're talking 8 to 10 parts per million. But a lot of people maybe try to speed 125 parts per million. But really for us at 125 parts per million, it's sometimes you see the response, sometimes you don't, So really for us, we're getting up to the 175 part per million where you really start seeing an impact, So something that's fairly easy, to utilize. I've seen a lot of new technologies lately that's, they're very, I think, in the beginning phases, where it's kind of an enzymatic process where they're kind of attacking the the Clostridium at some level. I think they've got a ways to go as far as understanding, how to produce it in a large scale, how to produce it, quality control, so it's standard, that sort of thing. But there's some interesting things in that regard. Everyone looked at probiotics and that sort of thing. I mean, there's a few of those out there that seem to help with that. So it's kind of, I think it's multifactorial whenever you're starting to look at something like that. I guess that's not the best answer. Everyone wants to know what the
right. Yeah. What's the one thing? Everybody wants the one. I want the one thing that's going to fix
one
it.
thing.
Yeah.
It's not there right now.
No. And that, we're constantly we're dealing with whatever the challenge is. And, right now all the industry is in a economic, so then no one's going to spend, they're trying to cut costs. So then things like you're talking about, like, oh, put in extra copper. No, that's not, going to happen. We are doing the, the bare minimum. We're not going to put in, okay, we get necrotic, we're going to deal with it, so that's why I was curious, like, okay, if if we're the, you're in Sweden or wherever, and it's not the US market, what would be, not to call out just Sweden, sorry, I shouldn't do that, but you're in, small sort of, so I think that's the other, we're in such large production, and not even just the US, but Brazil and other countries, it's like you were talking about, density, I think, plays into it, and ingredients, like you just have, it's the nature of our industry, and we have to work with all of the challenges. So I am curious, just because I find that the, sort of the microbiome and how we shift that is another topic that everyone likes to talk about. So in terms of what you guys see in your research model, how, at what time point do you feel like you're actually making substantial change in sort of the bird's gut microflora?
Yeah, I mean, that's a good question. And people that are much more educated in that area than me study it quite frequently, but some of the stuff I was doing in my PhD with is more from a muscle perspective. We were looking at things in ovo, trying to influence from an in ovo perspective. And, how does that, and in the first 2 days of nutrition, that's more nutritional than, direct impact on the microbial population. But, looking at stuff very early, and I think there's a great opportunity very early on to influence the gut in that way. And just, it's more anecdotal, than it is, purely scientific, but still what I'm talking about with the clean litter versus the reused litter, there's obviously something going on pretty quickly. That's it. We challenge at day 17, and, so 0 to 17, there's something going on there, but I think you have a really big opportunity early on, the first 2 or 3 days. And we even see that, when we get birds from the hatchery, right? I mean, we'll see mortality from 0 to 3 days of age. And, obviously it's coming from other things, but there's a microbial component to that, I believe. And, whether that's coming from some sort of maternal transmission, something in the hatchery itself, they might be exposed to something in the hatchery during transport that's causing some of that. So I think you have a really large opportunity first 2 or 3 days to do something like that. But one thing we see with our model as well that's indicational even later on, you've got some opportunity is even, I don't really like to take the model too far out. I mean, we have some clients that'll take it to 42 days, but at day 17, usually by day 28, it's subsiding quite a bit. So most of our signs of necrotic are gone by then. A few cases, we'll see it a little bit longer. And part of this is, once again, a density issue. If we have some mortality in some challenge groups versus non-challenge groups, but we do see the birds do very well once they recover. So, I mean, there is obviously, I think, physical intestinal turnover happening after the assault on the intestine, but that gives you an opportunity once again, from a microbial standpoint, there's definitely some kind of change going on there. What can you do as they recover from that? If you have birds that are not dying from it, what can you help them recover and get through it faster? And then on the backside of that, they're going to do
So have you guys looked at any of those kinds of products? That's what like people ask me all the time. Like, okay, we're NAE and we've got a necrotic challenge. You can't really do you have products that you're like, yes, we see, shorter clinical course of disease if we use this.
I would other than the copper and some of the probiotics, DFMs, we'll see that sometimes in some of the newer technologies, and we're starting to see some plant-based products that have some interest to me. And these are small differences. They're not gigantic differences, and so I really can't recommend one class of that. And I would say maybe it's even our fault at times. We're not looking at it like that. Some people are interested in recovery, but we're looking at the recovery just extending the study out. There's probably some things we need to do fundamentally when we're looking at that. Once it kind of subsides, what can we do within the study itself? We've had conversations about trying to, kind of generalize a bird density, try to make everyone more uniform at that point, and then move on. So I don't think we look at it necessarily correctly in the recovery period. It's just a matter, let's just keep it going. What do they look like from day 28 to 42? Hey, we recovered better. Well, part of the problem you get, obviously, with a challenge model, you get a lot of variation. And of course, if you're doing something with statistics, that kind of messes that up where you're trying to find any kind of difference. And you're introducing variation just by having a challenge model in and of itself. And so I think it's something we all need to consider if we're looking at the recovery period. What can we do to try to minimize variation from, kind of when they recover on? And we don't really do that with our studies at this time. We've done it a few times, but we just kind of carry it out directly. But yeah, so me from a nutrition standpoint, if I was in academia, maybe you always think about, well, what if I became a professor or something like that? What area would I like to look at? And because we really don't have that luxury here, right? I mean, we're running
you're doing whatever study comes to your door.
Yeah, exactly. So it's fun to think about things, but you're also trying to help the client. They're looking at things, just whatever we can do for them. But just based on kind of my PhD with, are you setting the animal up for a different nutritional requirement? And so I think that's something of interest. And some people are starting to look at that. I think that, they've looked at some of the enzymes, like phytase or something during a challenge, or how's calcium utilized, or even some amino acids potentially. But I think that's something else to consider is, if you have a large disease outbreak, what's that do to your nutritional requirement or nutritional needs after that to help them recover? I think that's probably an area that's, or at least me personally, is something that's interesting to look at, in combination with, some type of DFM or something.
Awesome. So I think we've kind of covered that part of your work. So what are, in terms of, are there, I know that's kind of your bread and butter is, necrotic enteritis and coccidiosis. Other, things that you see on the forefront in terms of, you're there in terms of products. You'd mentioned these sort of like enzyme type of products for Clostridia challenges. What are the next new things that you see come in towards our industry?
And I would say it's probably not necessarily new, but some of the plant-based products, some of the different organic acids, essential oils, like I said, those aren't necessarily new things, but I think how they're utilizing them, how they're understanding them, and how they're producing them are new. Because 5-6 years ago, I wasn't quite seeing the responses at times that I see now. So with some clients, if I see something that's interesting, I'll say, hey, let's, we'll try to figure out another plan to look at something that they may not have had I don't try to go, hey, we need another study, or hey, we finished this study, you need to do 4 more. I don't operate like that. But if I see something that's interesting, I'll say, hey, this looked really interesting. We may not have tease the differences you wanted to see, but let's try it again with something a little bit different and see if we can see that response. Because I think the way they're producing them, I think the quality control, I think, trying to get a product that's more consistent. I think that's some issues you have sometimes when you're developing new products or working with some of these products, if it's an extract or if it's a byproduct of something else, as we all know with other products, what's the variability within that product itself? So I think there's some new plant type based products, which, you would ask me 5 years ago, I say they don't work.
Right. And I think that's like stuck for people, but I think that's great that you're saying that they are, evolving and becoming, more consistent, and you are starting to see some effects from some of those.
Yeah, it makes me really excited to see that. I mean, to be honest here, maybe it's 30% of the time where we see a nice response in our model. You know what I mean? So I feel like if we see response, it's kind of a big deal. And we're starting to see that. And I don't, a lot of times to me, I'll just see a trade name or I'll just see a product classification when I'm dealing with the client. I don't have the full background of the product necessarily. I mean, some of them share it, some don't. I don't really ask for it. I'm trying to give them the study based on what we're trying to accomplish. So some of it, I don't know the full background or the science necessarily behind it or their production parameters, but I am seeing some stuff that seems more interesting in those general categories.
Great. Well, we look forward to learning more, and hopefully that those trends continue. I think that's a lot of people's, as they've used these products, they're like, oh, I tried that. It didn't work. And I
Right,
also
exactly.
feel like a lot of times you'll try something on one farm and then your judgment is that's not going to work. So I think you have to keep trying or try a different version or try a different formulation because, you could have dropped it off and the grower didn't mix it right, how it gets applied. And then you make that, oh no, I tried, whatever plant product and it didn't work.
Well, we work with a lot of startup companies here as well. So very, very early in the process for them. And they might bring a product to us and it works, and then we might do a second run and it doesn't work. And they'll be like, oh, what happened? What happened?
We're dealing with biological models. That's what happened.
Yeah, exactly. That's part of it. And they'll say, well, we switched this kind of ingredient in our batch production process, or we're trying to scale up, and we missed this piece of it. We're trying to scale up, so there's a lot of that goes into it. And you're dealing with biological model. Yes, can be very frustrating at times.
Right. They don't read the book. They don't
not
answer and spit out results.
And that's what I always try to sell to people, why I'm not on the ruminant side. The birds are way more uniform and we can go after it that way, but the birds still aren't that uniform type. So yeah.
Yeah. They don't perform on cue like we would like. Well, is there anything, like sort of big picture, in terms of like enteric health and gut health and the things that, kind of are your everyday, that you would share with, folks in the poultry industry out there, dealing with it every day? What are like, top messages for them?
Well, and I think we've covered a lot of it here already. And it's something that I really have thought, my whole career, at least starting with the feed additive company all the way to here. And I would say that's pretty true. Don't narrow yourself down to one product or, one program or anything like that. It takes a combination of different things, environmental. It takes a combination of different products you're going to use. I think it's a whole program approach, which I know we preach and talk about quite a little bit, but we all get narrowed down into it, whether it's because the message we're receiving from different groups, it's one topic at a time or one product at a time, or whether it's economic that we can't afford to put 5 different products in the feed or the water line or whatever. It just becomes too expensive to do. I think there's probably some companies with a little bit better leverage for that than others because they have more products they're dealing with. But I think it's a bigger program approach versus we're just going to throw one product in there and save the day. I just don't think that exists. And if that does exist, a lot of times there's some resistance or something like that can be developed. I mean, if you're doing something at that level, you're probably doing something antimicrobial, and then that usually happens with some resistance down the road. So, I mean, I would encourage people to think more from a big picture standpoint, as you and I joked a little bit from between the vets and the nutritionists, but I think it's the whole system with the people, with the products, with the management. I think that's something to really focus on. And that's something we see here a lot because, we'll test one product, it doesn't work. Someone else will come in and test a product, it doesn't work. And then someone either has the opportunity or wherewithal or whatever. Since we're private, people don't see it all the time. They'll try a couple different combinations and that may work, So I would say keep things open. I can be a little narrow-minded myself. Growing up in the Midwest, we kind of have a way and bam, that's it.
Oh,
Yeah. But I think it helps to stay open-minded with a lot of that stuff. And, like we talked about before, if you asked me 5 or 6 years ago, you'd ask me about some of the plant products. I say absolutely not. But we're starting to see stuff work now. So, like I said, program, was a kind of a larger picture approach from environmental to products to the whole team working together. I mean, I think that's your best approach to stuff like this.
It's time for our famous 3. Natural Biologics is using cutting-edge science to dig deeper into the poultry health challenges you face. By gathering scientific evidence, they identify the most effective combinations of natural ingredients that improve animal health. Visit naturalbiologics.com/poultry to see the newest research in both turkeys and chickens. When it comes to raising healthy animals, you need more than the right solutions. You need the right partner who brings decades of industry expertise and a global team to put that knowledge to work for the advancement of your operation. At Phibro Animal Health Corporation, we are proud to work with you as your trusted partner. Eastman serves veterinarians and nutritionists in agrochemical and animal health industries by helping them select, evaluate, and implement innovative nutritional programs. Eastman works with your team to customize your gut health approach in feed and water. Eastman's approach addresses nutritional and bacterial challenges and finds new ingredient preservation and hygiene solutions. Explore ways to accelerate and innovate your programs. Contact the animal nutrition team at eastman.com.
so we'll kind of shift gears here to wrap up. So, what sort of advice do you have for? Sometimes we have students that might tune in, and being in academia, I'm with students all the time. So, what advice do you have? Like, people coming up through sort of the poultry nutrition sector. What advice do you have for them?
I think it really depends on kind of the lifestyle you want to have, right? I mean, it's a little bit different than just going, well, I want to be this, or I want to be a corporate nutritionist, or I want to be a technical person, or I want to be research, or I want to be XYZ. I mean, even me going through it took some time, because you hear that. So, I mean, you need to think about, do you want to represent one product? Right. I mean, that's a different approach. I didn't know any of this. And I've been on a couple of different sides of it now. If you're a technical person, you're going in, you're selling to a client. That can be real exciting, doing research, learning about different products, but you become an expert in a certain product and you're selling that to either a nutritionist or a veterinarian or a CFO or something like that. So, I mean, if you like that challenge and you like to really get down and learn one product or a series of products and more corporate style, I think that's something you got to think about. The other thing, if you're a corporate nutritionist, where you really have a large impact in production, you get to do a lot of problem solving, a lot of real-time problem solving. It can be very frustrating at times, but very rewarding at times. I mean, and it'd be stressful. Do you want that kind of stress? Academia, do you want to go into academics? Do you like working with young people? Do you want to create new things? That sort of thing. So I think it's really more of a lifestyle, what you're interested in versus I want to work for this company, or I want to work at this university, or I want to work for this, integrator specifically. I think you can't approach it from that angle. I think you have to approach from the angle, what would you like from a lifestyle perspective and what you want to do with your career. I did my postdoc, and it's something completely different. And I would say stay open-minded about it, even as you're approaching graduate school. You've made the decision, obviously, you're interested in poultry, you're interested in animal agriculture. So you're in the right thing, you're in the right direction. Then at that point, it's about what do you really want to do with your life, your lifestyle, and how you want to help the industry. because I think you can help the industry in multiple different ways. It's just how you want to direct it and how your relationships in the industry are going to be. So I think you need to think about it from that standpoint a little bit.
Excellent. That was all good. I'm a big, emphasize. I feel like if you get, kind of your life situation right, like everything sort of falls into place. Like,
Exactly.
yeah, yeah.
Exactly. I agree.
If you figure out that side, and like if you, as you said, you went into something that you didn't really like, and you've kind of come back to, this is what I always thought I wanted to do. So you found like, this is what I've always known that I wanted to do. And, if you find, if you do something that you really enjoy every day,
It does. And don't be afraid to take chances. I moved my family 3/4 away across the country because we were back
yeah,
in North Carolina.
Fort Collins.
Yeah. And so we, cashed in the family savings, came out here, bought into the company, and make a go of it. So if it's what you like to do it. Don't be too hesitant about it.
Excellent. All right. Well, Dan, it's really been a pleasure chatting with you. And I think we've covered a really pertinent topic for the poultry industry in terms of enteric health and our friend necrotic enteritis that
Yeah.
we don't really want to deal with, but do plenty. So if any of you in the audience have questions about what they do, or you're interested more in terms of what services they have to offer, I know you can Google and find them. And you should be able to get in touch with Dan directly. So
Well, thank you very much. I appreciate it.
excellent. Thanks.